So you've just been diagnosed with cancer, and you're appropriately worried, anxious, scared, even terrified. Or maybe you've just found a lump that you think may be cancer. You don't know which way to turn. You can't think. Your brain is almost paralyzed. Your doctor is pressuring you to have surgery or chemotherapy or radiation right away. Your family is worried and upset, and they're pressuring you too. And your friends are giving their advice. Everyone's telling you what to do, but you're numb. It almost doesn't seem real. You're wondering, how could this be happening to you? Well, I know exactly how you feel. I've been right there myself. I'm not only a doctor, but I was a patient with cancer, severe advanced cancer. At one point, I was sent home to die. But I'm here to tell you that cancer doesn't scare me anymore. I had it and got well, without chemotherapy, without radiation, and without mutilating surgery. I got well by rebuilding my immune system by totally natural methods. When you've just been diagnosed with cancer, the fear can paralyze you so you can hardly think straight. But in this video, I'm going to show you that you don't have to fear cancer like everyone else does. You can learn about the factors that cause cancer and understand that you can take control of your health and get well. I'm going to lead you through the problems and questions that arise from the beginning when you first get your diagnosis or when you're just suspecting that something is very wrong with your health. And I'll show you how you can understand the steps you need to take to keep from damaging your body even more and instead get well. These principles will apply no matter what kind of cancer you have. Cancer is serious, but you have time to make intelligent decisions. Don't let anyone pressure you into rapidly making decisions that you don't understand or haven't had time to evaluate. Your cancer took years to develop. It didn't just happen yesterday or last week or last month. Cancer has been present in your body years before it becomes obvious or diagnosable. Now be sure you have a pencil and paper ready to take notes. It's been said that people only remember about 10% of what they hear, so please take notes. And watch this video repeatedly until you absorb and understand everything you need to know. Now let me give you my credentials. I'm Dr. Lorraine Day. I'm an MD, a medical doctor, trained in orthodox conventional medicine. I've never been on the fringes of medicine. For 15 years, I was on the faculty of the University of California, San Francisco School of Medicine as associate professor and vice chairman of the Department of Orthopedic Surgery. I was also chief of orthopedic surgery at San Francisco General Hospital, where I directed the equivalent of a MASH unit. I operated on the patients with gunshot wounds and stabbings, the severely injured accident victims, and all the other victims of violence, including gang violence that occurs in San Francisco. And during this time, I trained hundreds of doctors. But in 1992, I developed cancer, breast cancer. The lump was small at first, about half the size of an almond. It wasn't very worrisome to me because it was fairly high on my chest. I didn't think it was cancer, and certainly not breast cancer because of its location. But because it became irritated when I fastened my car seat belt, I decided to have it removed. When the lump was removed, the pathologist's diagnosis was cancer, invasive ductal adenocarcinoma of the breast, and it had already spread into the muscles of my chest wall. This was confirmed by numerous pathologists who examined the biopsy specimen. I was advised to have mastectomy and radiation, but I refused. I did allow a second biopsy through the same small incision 2 weeks later by another surgeon at another cancer hospital to see if the surgeon could remove all the tissue that was involved with the cancer. But cancer tissue still remained, and I was again advised at least to have radiation and preferably a mastectomy. My surgeon was a personal friend, someone I had known since my medical school days. We were in training at the same time, and he was concerned for my life. When he realized that I was completely against mastectomy, radiation, and chemotherapy, he was astonished and confused and very worried about me. Of course, he couldn't understand my reasoning. I had taken my training at the same university medical school that he had, the University of California, San Francisco School of Medicine. He knew very well that I had been a professor there for 15 years. Where had I gotten these strange ideas? I told him that I had seen too many thousands of patients die from the treatments we give them. He couldn't disagree with that. I told him that the way we doctors are taught to treat cancer is barbaric and worthy of the Dark Ages. With our treatments, we cause additional, intense, horrible suffering to a person who is already ill. He couldn't argue with that, except to admit that that's all we're taught to do. And I discussed with him that radiation and chemotherapy both cause cancer, and I reminded him that I already had cancer. And I said that chemotherapy and radiation would destroy my immune system. Why would I want to do more damage to my immune system, the one system that could get me well? He couldn't disagree with that. Yet he pled with me and even pressured me at least to sit down and talk with the radiation doctor. I refused. He pled again. I politely refused. Finally, he said, "Are you just worried that after radiation you'll have a breast that's leathery, deformed, and discolored?" And I said, "Well, yeah, that too." Then I handed him 4 or 5 books on alternative therapies with testimonials of many who had reversed their cancers. I'm quite sure he's never opened the cover of even one of those books. So I went home and dramatically changed my diet immediately. I knew that the proper diet was critical for recovery. I started on a totally vegetarian diet, a vegan diet. That means no meat, no poultry, no fish, no milk, no cheese, or any other dairy products, and no eggs. I also eliminated refined sugar and all processed food. I ate nothing from a box or a can. Everything was in its most natural form, right from the garden or off of the tree. And I started drinking a lot of fresh homemade vegetable juice. Everything went fine for a while. The diet was the right diet, but I soon found out that diet alone is not enough to reverse cancer or other serious diseases. But at that time, I didn't know what else was necessary. About 9 months later, my tumor returned in the very same place. This time, it was a little larger, about the size of a marble. Now I was very concerned. It was clear that my dietary changes were not enough to get me well. I had read a lot about alternative therapies, and I started trying one after another, trying each one long enough to see if it would work. Eventually, I tried over 40 different types of alternative therapies, and none of them worked. I discussed the 40 I tried and many more on my video, Sorting Through the Maze of Alternative Medicine, What Works, What Doesn't, and Why. Then suddenly, my tumor grew from the size of a marble to the size of a large grapefruit, and it did this just over a period of just 3 weeks. Here's a side view. That's tumor. And this view shows the full extent of the tumor. It was the size of a softball. By this time, the cancer had spread to the lymph nodes under my arm and at the base of my neck, and I knew I was in big trouble. At first, surprisingly, the tumor wasn't very painful, but over time the pain became more and more intense until even the strongest narcotic pain medicine wouldn't touch it. Up until this time, I was still working, which was a big mistake. I should have stopped working and concentrated on getting well. I was even still traveling. But I found out it's impossible to stay on the total plan necessary to get well while you're traveling. Now I became so sick I had to close my office. As things got worse, I became essentially bedridden, and the pain continued to increase. The tumor was so heavy that when I got up, even to go to the bathroom, I had to support the weight of the tumor with my hand. My body was in total collapse. I had symptoms of numerous other diseases besides cancer. Not only did I have this huge, painful tumor on my chest that I had to look at every day, but I had developed a tremor in my right hand that was a specific symptom of Parkinson's, like this. In addition, I had symptoms of multiple sclerosis on the left side of my body. My leg became numb from my knee down. I lost some control of my left leg, and my left arm felt like someone was always grabbing it. The tips of my fingers and toes became numb and cold, a disorder called Raynaud's syndrome. I developed what appeared to be allergies to all foods except 3. Whenever I would eat any other foods, I would collapse and have to be on oxygen. And I was overwhelmed with depression and anxiety to the point that my heart felt like it was going to jump right out of my chest. I was a mess. For over a year, I continued to get worse, all the time becoming more anxious and more discouraged. But I kept going forward. I kept studying and trying one thing after another. And I kept studying the Bible and praying, asking the Lord to show me how to get well. But nothing worked. My cancer kept getting worse. Because my pain was becoming intolerable, I found one surgeon who was willing to remove a portion of the tumor just for pain relief, without forcing me to have mastectomy or a chemotherapy. And all the rest of the tumor was left in place, including the lymph nodes. Then they sent me home to die. I became so sick that I was essentially bedridden for 6 months. As my cancer progressed, I became unable to eat and then unable to take fluids. At one point, I was not expected to live through the night. My husband, who saw my life rapidly ebbing away as my breathing became more and more labored, said to me, "I've got to take you to the emergency room. You're dying." And I knew I was. As a trauma surgeon caring for victims of massive injuries, I've seen a lot of people die. I know what death looks like, and I was dying. But I refused to go. I knew that if I went to the hospital, they would give me drugs, and I had so little life left in me that the drugs would kill me. I also knew that God says in His Word that He forgives all our sins and heals all our diseases. God says, "I am the Lord who heals you." My husband and I had been praying together 3 times a day, every day since I'd been ill. I had claimed the healing promises in the Bible, while at the same time following everything I knew how to do, including eating the original diet God gave in the Garden of Eden: fruits, grains, and vegetables in their most natural form. I decided I had to continue to trust God. I wanted to stay under His protection and depend on Him rather than depend on human medical knowledge, which is nothing more than drugs. The English word pharmacy comes from the Greek word pharmakia. It means sorceries and witchcraft. The word druggist, pharmacist, comes from the Greek word pharmakon, which means poisoner. I wouldn't take drugs. I prayed silently and admitted to the Lord that I had no idea how I could get well at this point. I had tried everything I knew how to do, and everything had failed. But I was going to trust God completely. My husband prayed over me all night long, and I continued to pray silently. I didn't have enough energy to pray out loud. Because I'd been unable to eat for 2 weeks nor take in fluids for 3 days, I was rapidly becoming very dehydrated. I knew I couldn't live much longer without water. Then the Lord impressed on my mind something I had heard was done in medicine 60 or 70 years ago, before the introduction of intravenous fluids. Dehydrated patients could be rehydrated through the colon by water dripped in slowly by enema. The colon can absorb water and even nutrition in the form of wheatgrass juice, carrot juice, or green leafy vegetable juice. That's the way I stayed alive for the next few days until I could drink. At that point of death, I had decided to trust God with my life, and He showed me what to do. Then over the next few weeks and months, I started to understand the rest of the 10-step plan. Sometimes the information would come to me through the mail anonymously. Sometimes I would be impressed to study in a certain area, and information that I had previously read now became clear in the way it applied to my situation. Of course, all the time I continued to pray and ask the Lord to show me the way to get well. Finally, the entire plan became clear. From the time I started on the whole 10-step plan with 100% commitment, it was just 8 months until all my cancer was gone. It went away slowly, 1 day at a time. Then it took an additional 10 months for me to regain my strength. So in 18 months, I was totally well and cancer-free. I'll soon be 64 years old, and I'm healthier than when I was 30. I have lots of energy, and I don't have an ache or a pain anywhere. So what does cause cancer? The medical establishment seems to be continuously scratching their heads wondering what the causes could be. And they're really only looking in one place, and that's genetics. But cancer is not genetic. A genetic link can clearly be disproved in almost every case just by a little common sense. Here's an illustration. Breast cancer. Since the early 1900s, the incidence of breast cancer has continued to rise dramatically. All the experts and national medical organizations agree. Well, in the early 1900s, it was the grandmothers of today's women who were alive, your grandmother and my grandmother. But they had a very low incidence of breast cancer compared to their granddaughters, we who are alive today. Clearly, if the incidence of breast cancer is rising dramatically, it cannot be due to a genetic transmission from one's ancestors, because the ancestors of the women today rarely had breast cancer. Look at the incidence of breast cancer in Japan. In the grandmothers in Japan, who have been eating a diet mainly of rice and vegetables and a small amount of fish, the incidence of breast cancer has been very low. But take those same women and bring them to America and put them on a rich Western diet, which is largely meat, chicken, dairy products, eggs, and processed food, and you'll find that their incidence of breast cancer and virtually every other cancer becomes the same as Americans. Even the young women who are still in Japan but who are now eating a diet similar to the rich Western diet, they're developing the same incidence of breast cancer and many other cancers that young American women are developing. If this were a genetic problem, there would be a high incidence in the grandmothers who would then be passing it down to their granddaughters, but this is not the case. It's the reverse. The grandmothers don't have breast cancer, and the granddaughters do. We see the same pattern with arthritis, autoimmune disease, diabetes, and many other diseases. They're not genetic. It's their diet and lifestyle. Cancer and virtually every other disease is caused by a combination of three factors: malnutrition, dehydration, and stress. Malnutrition is rampant in the United States. Now, this has nothing to do with not eating enough calories. People are eating too many calories, but it's a diet high in fat and protein and very low in vitamins and minerals from fruits, vegetables, and grains. So it's a diet of excess on one hand, too much animal fat and protein, and a diet of deficiency on the other hand, not enough fruit, grains, and vegetables. The second factor is dehydration, because no one's drinking water anymore. Everyone's drinking coffee and soda. The body is 75% water, and the brain is 85% water. The brain is not 85% Coke, and it's not 85% coffee. It's 85% water. Caffeine is a diuretic. It takes more water out of your body than comes in with a drink. When cells become progressively dehydrated, they start getting sick and malfunctioning, and then you get sick. And the third cause is stress. Now, I'm not suggesting that you drop out of society, but there is a way to reduce your stress and learn to handle it properly. Stress is a major cause of every disease. This booklet is published by the American Cancer Society. It's a cancer journal for clinicians. This is the November-December 1999 issue, and it says on page 347 that a third of all cancers could be prevented by a change in diet and lifestyle, by increasing the intake of fruits and vegetables and reducing the consumption of red meat and animal fats, and by exercising. They add that there is a wealth of new data on diet and cancer in the last 2 decades, and that's continued to support the hypothesis that nutrition is a major influence in the cause and prevention of cancer. And that's a quote. Well, how about that? The American Cancer Society finally admits that what you eat actually has something to do with how healthy or how sick you are. Imagine that. The Harvard School of Public Health makes even more dramatic statements. They admit that 65% of all cancers could be prevented by a change in diet and lifestyle. I believe that a change in diet and lifestyle would prevent 99.9% of all cancers, but these other organizations are at least recognizing the truth somewhat. Now let's use a little common sense. If, as both the American Cancer Society and the Harvard School of Public Health say, that a change in diet and lifestyle could prevent between 1/3 and 2/3 of all cancers, then how do you reverse cancer once you have it? Well, first of all, you stop putting into your body the things that cause the cancer in the first place. And yet, when you go to the hospital and they fill you with chemotherapy and radiation, they also bring you the very food that the American Cancer Society says causes cancer. That's the same thing they do with heart patients who undergo coronary artery bypass. The meals they bring them are meat or chicken with gravies and dessert, a high sugar, high animal fat diet, which are some of the main factors that got the patient there in the first place. If the doctors in the hospital are looking for a repeat patient for another coronary artery bypass, that's the way to feed them. That's also the way to increase the growth of the cancer in a cancer patient. So the proper diet is critical for recovery from cancer, but it's only 10% of the total plan necessary to get well. Diet alone, even the proper one, is not enough by itself to get you well from cancer. Are all cancers different, or are they basically the same? We doctors organize the types of cancer and categorize them into many subcategories, but cancer is cancer. Virtually all cancer is a result of an immune system that's not working properly. It's your immune system that resists disease and gets you well when you're sick, and keeps you well if it's functioning properly. It doesn't matter whether it's breast cancer or prostate cancer or cancer of the stomach or leukemia or brain cancer or Hodgkin's or any other type of cancer. All cancer is the result of an immune system that's not working properly. When you rebuild your immune system by natural methods, then your immune system can fight the cancer. Well, don't some of these alternative natural treatments work better for some people and others work better for other people since everybody is different? Well, I've got some shocking news for you. Everybody is not different. Everybody is exactly the same on the inside. Our personalities are different, but we're all the same on the inside. That's why we can have medical textbooks, textbooks of anatomy and textbooks of physiology, because everybody's the same on the inside. What if you came to me as a patient and you said, I have pain in my left shoulder, and I said to you, well, maybe it's your appendix. And you would say, no, my appendix is down here in my abdomen. And I'd say, well, no, everybody's different. We don't know where your appendix is. Of course we know, because everybody's appendix is in the same place. And everybody's stomach works like everybody else's stomach. And your intestines work like my intestines, and your heart works like my heart. That's why we surgeons know where to cut to find various organs on everybody, because everybody's the same. So since your physiology and your anatomy are the same as everybody else's, then everyone's immune system can be rebuilt by the same natural methods. So the same health plan works for everyone. So what are these 10 steps, these 10 natural laws of health? Briefly, they are the following. Oh, by the way, I discussed the plan I use to get well in great detail on my video, You Can't Improve on God. But here's the plan in brief. First is proper nutrition, as we discussed. As I said, even the American Cancer Society and the Harvard School of Public Health admit that a diet of fruits, grains, and vegetables is one of the best preventions for cancer, and that a diet high in animal fat is one of the causes of cancer. 3 meals a day of only natural, unprocessed food and lots of fresh homemade vegetable juice. That's the diet. Second, exercise. Numerous medical studies have shown that a regular exercise program has a profound effect in reducing the incidence of cancer. For instance, studies have shown that 4 hours per week of exercise results in a 66% decrease in the incidence of breast cancer in women. 3 is water drinking. As I said, the body is 75% water, the brain is 85% water. We lose 10 glasses of water from our body every day just by living. If we don't replace those water losses, and if we drink caffeine and alcohol, both of which are diuretics that take more water out of your body than comes in with the drink, we are slowly but progressively dehydrating our body and making ourselves sick one day at a time. Dehydration is one of the causes of virtually all disease, including cancer. Sunlight, absolutely necessary for good health. You can't grow a healthy garden nor a healthy body without sunlight. Sunlight boosts the immune system and decreases the size of internal cancerous tumors, along with many other advantages. 5 is temperance. That means elimination of all harmful substances such as caffeine, alcohol, tobacco, sugar, NutraSweet, MSG, food preservatives, food dyes, and other food chemicals, processed food, and drugs, both street drugs and drug medications. All drug medications have side effects that are harmful to your body. Now, I'm not suggesting that anybody stop their medications abruptly. That's dangerous. But as you get on a totally natural program and rebuild your immune system, eventually you'll not need drug medications anymore. Fresh air. Outside air is essential for good health. Cancerous tumors grow twice as fast if a person is breathing indoor air compared to breathing outdoor air. If you're being treated for your illness in a hospital, you are continuously breathing in the exhaled air of every other sick patient in the hospital. Hospitals frequently have the windows sealed shut. And in the intensive care unit, the lights are often on 24 hours a day, upsetting the patient's circadian rhythm. That's their day-night cycle. That's a critical factor in causing disease. Next is proper rest at the proper time of night. The only time your body can really repair itself is when you're sleeping. Every cancer patient should be in bed by 9:30 p.m. at least. That's when the healing hormones begin to be produced, but you must be asleep to get the benefit. Stress relief. Stress is one of the major causes of all disease, including cancer. The best way to relieve stress, as documented by medical studies, is to learn to trust in God and read the Bible. Eastern meditation and visualization are to be avoided if you really want to get well. Well, can I get well without trusting in God? The answer is the better you eat and live, the healthier you'll be. But in order to reverse a serious disease like cancer, you've got to change everything about your life. And that's impossible to do without God's help. I hear people say, but I'm not interested in this God and religion stuff. Well, my answer is, look where you've gotten yourself on your own. You have cancer as I did. I had been an agnostic for all of my adult life, but I figured I needed all the help I could get, and that included God. 9 is an attitude of gratitude. Be thankful for what you have. The words that come out of your mouth in large part create your reality. I can tell within 5 minutes of talking to a person with cancer whether they're going to get well or not. If they're complaining and whining and focusing on their own weaknesses and trying to blame others or God for their illness, they have no chance in getting well. It's the person who's committed to doing everything necessary, who has an upbeat, positive spirit, who will grab hold of the plan with 100% commitment. That person will get well. And the 10th step is a spirit of benevolence. Get outside yourself. Selfishness is a problem with everyone. We've got to learn to care about other people and quit focusing on ourselves so much. The Bible says that if you care for others, your health will spring forth speedily. If you're very sick and bedridden, as I was for a long period of time while I was ill, I couldn't do things for other people, but I could pray for them and quit focusing on my own problems. And what you put in your mind is just as important as what you put in your mouth. You can't get well if you watch regular entertainment TV. I had to stop watching even the news. No movies, no TV, no music except high-quality Christian music and classical music. and I read only the Bible and high-quality religious books. We must concentrate on only things that are true, honest, pure, beautiful, and good. Every negative thought must be eliminated from our mind. Now, I know these steps seem too simple. It's hard for the average person to believe that serious diseases like cancer can be reversed by such simple techniques. But as simple as they may seem, they're also difficult because they require a change in the way you live. We want to keep on living and eating the same way we always did and have the doctor just give us a little pill to solve the problem. But drugs never cure disease. Cancer is not caused by a deficiency of chemotherapy. Cancer is not caused by a deficiency of radiation or a deficiency of surgery. But cancer is caused by a violation of these 10 laws of health. There is a way for you to be well. As I said, I discussed this 10-step plan that I use to get well in detail on my video, You Can't Improve on God. And the good news is all 10 steps of the entire plan are completely free except for food, and you have to buy that anyway. Now you know there is a way to get well. You don't have to be pressured by doctors or family members or friends. And even though cancer is a serious disease and you must rebuild your immune system to reverse it, you and I know that you don't have to be afraid of cancer anymore. In order for you to be convinced that this plan works, you must start investigating it for yourself. Watch my videos repeatedly and take notes. Read the books and watch the videos I give you as reference material at the end of this video and my other videos. Start with one at a time. Don't just believe me. Learn for yourself. That's the only way you'll be convinced. Now, let's talk about conventional treatment for cancer. That's the treatment your doctor will advise you to have. In our medical training, we doctors, all of us, are taught only 3 ways to treat cancer: chemotherapy, radiation, and surgery. Let me tell you right up front, your doctor wants you to get well. He or she is trying their best to get you well, but they don't know how to do it because they've never learned, they've never been taught. All we doctors are ever taught in our training is to try to poison out the cancer with chemotherapy, burn out the cancer with radiation, or cut out the cancer with surgery, often mutilating surgery. But you see, these methods of treatment never cure cancer. Oh yes, there are some people who survive cancer after those treatments, but that's in spite of the treatment, not because of it. At first, the chemotherapy seems to work. The tumor gets smaller and your tumor marker blood test results may go down. But just because something seems to work, at least temporarily, does not mean it's good or it's right or that it will make you well. Street drugs make you feel good at first. They make you feel creative and uninhibited and euphoric. But later you pay a terrible price. It's the same with chemotherapy and radiation. You often end up paying with your life. Here's why conventional treatments never cure cancer. The only way you can really cure cancer or any other disease is to understand what causes it. When you find out the cause of any specific disease, you immediately know the cure for it. The cure lies in reversing the factors that cause the disease. But doctors admit they don't know what causes cancer, so how can they ever hope to cure it? But the causes of cancer are known. These 10 steps, these 10 natural health laws that I gave you, I found them all in the medical literature when I was searching for the way to get well. I was astonished, of course, to learn that they were all there. Yet no one ever told me about them during my medical training, and I never taught the doctors I trained because I didn't know. Why aren't we taught these things? Well, the pharmaceutical companies provide huge sums of money for medical research to find more drugs to treat disease. They're not going to provide funding to research the effect of fresh air and proper sleep on cancer or any other disease. They need a financial return on their research dollar. They need another drug to sell. Fresh air and sunlight and sleep are free. They can't be patented. They can't be sold for profit. This is just one of many examples I could give you. Follow the money. When pharmaceutical companies provide large research grants, millions and millions of dollars to medical schools, they have a lot of clout and directly or indirectly control much of what's taught to doctors in training. In medical textbooks, the cause of disease is termed the etiology. Etiology, that's just a fancy way of saying cause. Well, that designation, which years ago used to be listed under each category of disease in the textbooks, has been almost completely removed. The medical textbooks don't even discuss the etiology of cancer or most other diseases now because the medical establishment admits they don't know the cause. But treating cancer with chemotherapy or radiation or surgery really doesn't make any sense, and here's why. Because cancer is not caused by a deficiency of chemotherapy nor a deficiency of radiation. In fact, both chemotherapy and radiation actually cause cancer. Some people react to this statement with astonishment and horror, and sometimes they get angry with me. They say, "My doctor wouldn't give me chemotherapy or radiation for my cancer if these treatments cause cancer." Well, the answer is yes, he would, or yes, she would, because that's all they know how to do. In addition, if they don't prescribe those treatments, they're likely to be severely disciplined by their hospital or other medical governing organizations, and they may even lose their license to practice medicine. In California, it's against the law for a doctor to treat cancer in any way other than with chemotherapy, radiation, and surgery. In fact, I was handed this little booklet by the first doctor I went to. It's signed by the governor of California saying that a doctor can refuse to take care of a cancer patient if the patient refuses chemotherapy and radiation. Chemotherapy is poison, pure and simple. It does its work by poisoning the cancer cells. The problem is that it also poisons the normal cells. The doctor's hope is that since the cancer cells are multiplying faster than the normal cells, that the poisonous chemotherapy will destroy more cancer cells than normal cells, since the chemo is most effective against cells that are multiplying rapidly, the cancer cells. But the chemotherapy often kills so many normal cells that the patient either dies rapidly after the first round of chemotherapy treatments, or the chemotherapy does so much damage to the other organ systems that their body starts slowly deteriorating until all or nearly all systems fail and life is unsustainable and the patient dies. Doctors readily acknowledge among themselves that giving a cancer patient chemotherapy or radiation is always a race between killing the tumor or killing the entire patient. A person cannot develop cancer or any other disease for that matter if they have a healthy, properly functioning immune system. So when a patient has cancer, by definition, their immune system is already suppressed. It's not working properly. But chemotherapy and radiation destroy what's left of the person's immune system, the only system in your body that can get you well and keep you well, the very system you must have in order to get well. Oncology is the study of tumors, mainly cancerous tumors. This is a widely used oncology textbook. It says, and I quote, "Disorders of immune function are the basis of a wide variety of human illnesses." That's just what I said. Cancer is a disease resulting from a disorder of the immune system. So is virtually every other disease. So what is the immune system? Nearly every organ in the body is involved with fighting disease. The lungs filter out bacteria. The tears in the eyes help flush out bacteria and foreign material. Even the skin has unique disease-fighting capabilities. But the immune system is the name given to a collection of organs and cells in your body that has the primary job of fighting disease. I won't discuss the specific function of each cell or organ, but their names are probably at least somewhat familiar to you. Antibodies, immunoglobulins, T lymphocytes, B lymphocytes, monocytes, leukocytes. These last four are types of white blood cells that respond to bacteria and viruses and help eliminate damaged tissue, that's dead and dying tissue, from your body. Your lymph nodes are also part of your immune system. They produce lymphocytes and monocytes, types of disease-fighting white blood cells. And the lymph nodes act as filters, keeping bacteria and other debris from gaining entrance to your bloodstream. The lymph nodes also filter out cancer cells and help keep cancer from spreading. That's why I kept my lymph nodes, even though they were involved with my cancer. I would not allow them to be surgically removed. A major organ in the immune system is the liver, the great detoxifier of your body. The liver detoxifies the toxins that are produced as byproducts of digestion of normal food or toxins that have been added to the food, such as preservatives, fillers, and other chemicals in processed food, toxins from pesticides and other environmental pollutants, as well as one of the major causes of toxicity, the drug medications prescribed by your doctor. When the liver gets too full of these toxins, it can no longer perform its job of detoxification and purification of the blood. And this is one of the major causes of cancer. Then, the chemotherapy used for cancer treatment can cause so much additional toxicity that the liver becomes overwhelmed and overburdened, and the patient goes into liver failure and dies. The spleen is also involved in the formation and storage of different types of immune cells. In addition, the spleen filters out bacteria and removes dead or damaged red blood cells from the bloodstream. This, in a general way, is your immune system. When these cells and organs don't function properly, your immune system is compromised, suppressed. It cannot fight disease, and you get sick. There are many things that have an impact on our immune system. What we feed our bodies, the amount of exercise we get, the air we breathe, the amount of stress in our lives and how we handle it, how much sleep we get and when we get it, our attitude, whether it's positive or negative. All these things either strengthen or weaken our immune system. We can't develop cancer unless our immune system is weakened. Chemotherapy and radiation both not only destroy the immune system, but they both cause cancer. Now let's discuss chemotherapy specifically. Chemotherapy has severe side effects, including death. You can die from the chemotherapy, not necessarily from the cancer. I'm giving you information that frequently is glossed over by the doctors who prescribe these therapies. I know I will be severely criticized by my own medical colleagues for telling you the things you're about to hear. They'll accuse me of frightening patients out of the very treatment they need. That's what they'll say. But I think you have a right to know what's being done to you and the effect, both short-term and long-term, it will have on your body and mind. Often the doctors won't tell you the severity of the side effects because they know that if you're fully informed, you'll probably refuse the treatment. So they justify their withholding of the information by rationalizing that you really need the treatment, so it's okay to mislead you. As an example, this is what they're also doing with vaccination information. The medical establishment for years had a little information sheet that was given to the parents of children before each immunization shot. It discussed the potential dangers of vaccinations. It's called an informed consent. But they found that when the parents read the information, they refused vaccinations for their children. So committees got together and they pondered what to do about the problem, and they came up with their solution. They decided to water down the information and withhold from parents many of the horrendous side effects so they would agree to have their children vaccinated. And that's what's been done. There are few groups who surpass the organized medical establishment for deceit, fraud, and propaganda. Again, I'm not necessarily talking about your individual physician, but the organizations, the AMA, the FDA, the National Cancer Institute, and the American Cancer Society. Now, these are the common, immediate, generalized toxicities or the side effects of chemotherapy. Suppression of the bone marrow where your blood cells are produced. This results in decreased white blood cells, the disease-fighting cells you need to fight infection, decreased platelets, the blood clotting cells, so you can have severe episodes of bleeding, and anemia, a low red blood cell count. The second is severe nausea and vomiting. Third is mucous membrane ulceration. There you get painful sores in your mouth, in your esophagus, and even in the intestines, so eating becomes very painful. And what's called alopecia, or baldness. Your hair falls out. These effects and many others that are not so obvious occur because the chemotherapy is poisoning your normal cells. In this medical textbook, there are 50 pages on the toxic effects of chemotherapy. Additional complications include infections involving the teeth and their supporting structures, hemorrhage, that's bleeding, and cardiac toxicity. You have EKG changes, drug-induced cardiomyopathy, which causes congestive heart failure, such as shortness of breath, enlarged liver, ankle swelling, enlarged heart, and fluid in the lungs. And this can occur up to 7 years after your treatment. Plus, tachycardia, which is a rapid heart rate, and arrhythmias. Those are irregular heart rates. Then there's lung toxicity. Chemotherapy-induced injury to the lungs can be fatal and may occur after the drug has even been discontinued. It can cause chronic pneumonia and fibrosis, which is scarring, and fluid in the lungs. And it causes kidney damage that can progress to end-stage disease requiring chronic dialysis therapy. And then there's infection. Chemotherapy causes patients' immune systems to be further compromised. Then they're subject to a host of serious life-threatening bacteria and fungal infections that cause shortness of breath, chest pain, coughing up blood, fever, chills, headache, and hemorrhage. And then there's candidiasis and cryptococcus, which are other fungal infections. They cause cough, chest pain, shortness of breath, fever, again coughing up blood, and night sweats. Immune suppression from chemotherapy can also result in viral diseases such as cytomegalovirus. That's a herpes-like virus. And that leads to hepatitis, Guillain-Barré syndrome, which is a severe paralysis that can be fatal, encephalitis, myocarditis, that's inflammation of the heart, low platelets, those are the blood clotting cells, infection in the stomach, in the intestines, in the esophagus, and even the retina of the eye. Another viral disease, herpes, causes ulcers on the palate in your mouth, the gums, the tongue, the lip, or the facial area, and leads to bleeding, severe pain, and inability to eat or drink. Herpes infection in the esophagus leads to the inability to swallow and pain behind the sternum and weight loss. Another possible side effect of the chemotherapy is herpes zoster, which is shingles. This causes a deep searing, knife-like or burning pain and rash over almost any area of the body. Another disease that chemotherapy causes is pneumocystis pneumonia. That's an opportunistic infection that AIDS patients get. And toxoplasmosis, another fungal infection. It has severe central nervous system involvement in at least half of the cases of this disease in immunocompromised patients. It causes brain dysfunction with or without seizures and meningitis. Chemotherapy also causes constipation, diarrhea, skin necrosis, that means areas of your skin can die, and peripheral neuropathy, that's the loss of reflexes, and nerve numbness or pain and muscle wasting. A patient is usually told he or she will have to wait a month between treatments because the chemotherapy, which is your treatment, is so destructive to your body and the blood-forming cells in your bone marrow that you have to wait for the bone marrow to recuperate and begin making new cells again so you can have another destructive treatment to suppress your bone marrow and your immune system even more. To increase your red blood cell count so you won't be anemic, a drug like erythropoietin is given. But erythropoietin, which has brand names like Epigen or Epoetin, these drugs are used to treat the side effects of the chemotherapy, but they have lots of side effects as well. They cause headaches, fatigue, dizziness, seizure, stroke, nausea and vomiting, diarrhea, high blood pressure, joint pains, swelling, and life-threatening blood clots. Over time, chemotherapy causes damage to the heart, the lungs, the kidneys, with kidney failure, the immune system, and the blood-forming marrow, resulting in overwhelming bacterial infections. It also causes toxicity to nerves, resulting in the peripheral neuropathy that we spoke about. That's numbness and strange feelings, including pain in the feet and legs. Chemotherapy also causes serious endocrine problems, such as thyroid and other hormonal problems. It causes premature menopause and infertility. Plus, it causes secondary cancers, a second kind of cancer in addition to the one you already have. All these side effects are handled by the doctor prescribing more drugs with more side effects. Drugs such as steroids are given to decrease these side effects, but steroids like prednisone have more side effects, including diabetes, weight gain, osteoporosis, yeast infections, depression, sleeplessness, dementia, and psychosis, and increased susceptibility to infection and more suppression of the immune system. Just how devastating the side effects of chemotherapy can be is revealed in an illustration told by Dr. John Laszlo, who was Senior Vice President for Research at the American Cancer Society. Dr. Laszlo is considered an expert on the complications of cancer care. This is a quote from him. "Not only do many patients suffer from extreme nausea and vomiting," he writes, "but about 1/4 of the long-term patients become so conditioned to experience these symptoms, even in the absence of the actual drugs, that we have seen patients drive into the hospital parking lot and promptly begin to vomit, or vomit when they smell the alcohol sponge used to clean off the arm prior to the IV being replaced for the chemotherapy, or even vomit when they see the nurse who administers the chemotherapy, even if that person is encountered out of uniform in a supermarket or elsewhere away from the hospital." Chemotherapy is a systemic poison. It poisons your whole body. It appears to succeed for that very reason, at least temporarily. The tumor shrinks. But the chemotherapy fails for the very same reason. It's a systemic poison. In other words, it will shrink the tumor, and your tumor marker blood tests may go down for a while. It appears to be working, but it will also severely damage your immune system, so you will be in a seriously weakened condition when the cancer returns, which it always does. If you have enough immune system left to fight it, you may survive. But if you don't, the cancer takes over. John Cairns, a professor of microbiology in the School of Public Health at Harvard University, wrote in an article in the journal Scientific America that, quote, "Many of the drugs used to treat cancer are known to be carcinogenic, cancer-causing. And one of the long-term effects of chemotherapy is that somewhere between 5 and 10% of the surviving patients die of leukemia in the first 10 years after treatment. The chemotherapy, the treatment, causes the leukemia." He continues, "If cancer specialists were to admit publicly that chemotherapy is of limited usefulness and is often dangerous, the public might demand a radical change toward non-toxic methods and toward cancer prevention." To ward off these criticisms and demands, the use of chemotherapy is even advocated by those members of the medical establishment who realize how ineffective and dangerous it can be. Now let's look at radiation. Radiation is X-ray. Doctors and dentists tell you, don't get too many X-rays because X-rays cause cancer. But when you already have cancer, doctors tell you now you must have huge doses of what we otherwise tell you to avoid because it causes cancer. Let me offer you a proposition. If you have a young son or a daughter who's perfectly healthy, how about if I offer to pay for 6 months of radiation and 6 months of chemotherapy for them? It won't cost you a thing. Would you let me do it? Of course not. Why? Because it would make your child terribly sick and maybe even kill them. But think about it. If you won't let me do that to them when they're well, why would you let me or any other doctor do it to them when they're sick? It doesn't make sense. Here's a whole textbook entitled Radiation Protection in Medical Radiography. That's just a fancy word for X-ray. This textbook discusses all the hazards of radiation from X-rays and how medical personnel must protect themselves from its damaging side effects. Here are pictures of an X-ray pioneer who was exposed to radiation and first developed tanned, dried, and wrinkled skin. This picture is 5 years later. His skin is cracked, reddened, and rough. Notice that the damage can continue to occur for a long time. Later, cancer of the skin developed, and 1 year later, or 6 years after his original exposure, and after a series of operations including amputations, the man eventually died of metastases, cancer that spread to other vital organs and killed him. The government has very strict limits for exposure to radiation for medical workers. All medical personnel, including doctors, nurses, and technicians who work around X-ray machines of any type, are required to wear little X-ray badges that record how much radiation they receive during a specific period of time. These badges are turned in at certain specified intervals to monitor exactly how much exposure each person is getting because radiation is so dangerous. You'll notice that when a technician is taking an X-ray of you or giving you radiation therapy, that technician makes sure he or she is protected behind a lead wall. They never stay in the room with you unless they're wearing a lead apron to cover them. That's because radiation is so dangerous. But for you who are sick with a life-threatening disease, the American Cancer Society and the AMA and the FDA say radiation is safe and effective. How can they say it's safe and effective for you, but it's a dangerous hazard for them? Here is the current radiation protection philosophy. They admit that, quote, the most minuscule dose of radiation has the potential to cause harm, unquote, and that this is directly related to the amount of radiation dose to which you're exposed. The current philosophy, however, states that radiation also possesses beneficial as well as destructive potential. That certainly sounds like double talk. It means sometimes bad is actually good. This philosophy proposes that when employed in the healing arts for the welfare of the patient, the potential benefits of exposing the patient to radiation must far outweigh the potential risks involved. That means that if you're healthy and well, radiation is harmful for you. But if you're sick, especially with cancer, radiation is good for you. Yet this medical textbook states that ionizing radiation, that's the radiation we're talking about, damages living systems. This is a picture of a person's arm that received a radiation burn, showing that cancer that occurred as a direct result of the radiation caused this terrible problem. This textbook, Nursing Care in Radiation Oncology, discusses the problems that cancer patients have after receiving radiation treatments. It takes an entire textbook to cover them all. It also discusses the problems of secondary cancers caused by the radiation treatments. Let me read you a quote from this book. It says, exposure to radiation therapy or chemotherapy places an individual treated for one tumor at an increased risk for a second treatment-related malignancy. The current medical literature contains numerous case reports of persons treated with radiation therapy who have been diagnosed with other different kinds of cancer. And in this book, there are a couple of pages, total pages, of small excerpts from many different studies documenting many cases of second cancers caused by radiation treatment for the first cancer. And here I have many other excerpts from many different medical articles showing patients who developed cancer, other kinds of cancers than the one they were being treated for, after radiation therapy. Radiation treatments have generalized side effects to the whole body, as well as potentially severe side effects to the specific area where it's directed. Here are the generalized side effects. Early skin changes that can include redness of the skin, peeling of the skin, decreased sweating, swelling, ulceration, hemorrhage, that's bleeding, and necrosis, which means the death of the tissue. Your skin in that area can actually die. Late skin changes include atrophy, which is shriveling of the area, increased pigmentation, that's darkening of the skin, hair loss, ulceration, and in some cases death directly related to radiation's late side effects. With breast cancer, radiation can result in a shriveled, dark brown, scarred breast, as my surgeon commented to me. There are pictures actually in this book. Other radiation side effects are fatigue, nausea, vomiting, inflammation of the esophagus, inflammation of the stomach, diarrhea, and anemia. Now, listen to these documented side effects of radiation in children, depending on the area that receives the radiation. Nausea, vomiting, dehydration, headache, skin sensitivity, baldness, fatigue, brain swelling, suppression of the bone marrow, inflammation of the esophagus with difficulty swallowing, future infertility, abdominal cramping, diarrhea, inflammation of the lungs, increased susceptibility to fracture of the bones, pericarditis, that's inflammation of the sac surrounding the heart, pericardial effusion, that's fluid around the heart, cardiac arrhythmias, growth hormone deficiency, pituitary dysfunction, hypothyroidism, dysfunction of the ovaries, dysfunction of the testicles, intestinal obstruction, liver toxicity and scarring, shortened stature, scoliosis, that's curvature of the spine, kyphosis, that's another spinal deformity, dental abnormalities with asymmetry of the facial bones and the soft tissue on the face, dysfunction of the endocrine glands such as thyroid, decreased intelligence, memory impairment, impaired ability to think, death of areas of the brain, cataracts, damage to the retina of the eye, visual impairment, toxicity to the ears with hearing loss, kidney damage, and bladder scarring. Brachytherapy is a special kind of radiation involving the direct application to a tumor of a temporary or permanent radioactive source, such as radioactive implants, as is often done in prostate cancer. This causes the same kind of side effects too. How did radiation therapy gain such a foothold as a treatment for cancer when every doctor knows and every medical organization admits that radiation causes cancer? Charges of radiation dangers have often been voiced, but most often these charges have been ignored. Initially, this was due to the widespread enthusiasm for this new technique long ago. Radiation will often cause temporary remissions, but the cancer comes back often with a vengeance because nothing has been done to reverse the underlying factors that allowed the cancer to develop in the first place. Since radiation actually causes cancer, why is it used as a treatment for cancer? Radiation therapy has always been lucrative for hospitals, for equipment and film manufacturers, and for the radiologists themselves. Once millions of dollars are invested in equipment, there is a strong inducement to use that equipment despite newer information suggesting that its use should be curtailed. You'll see that in this very article. In the late 1970s, Dr. Erwin Bross, who held important positions at both Roswell Park and Johns Hopkins hospitals and had published over 300 medical articles, failed to get a renewal of his government research grants because he had spoken out on the subject of radiation dangers. Dr. Bross pointed out a 30-year cover-up of radiation hazards and in particular the role of doctors in promoting that danger. He wanted to study the danger of radiation specifically and radiation's role in causing additional disease when it was prescribed by doctors for treatment. But he found out that it's almost impossible to get government funding for a study of iatrogenic, that means doctor-caused disease. And here's a quote. He says, "You just can't get people associated with the medical profession to accept a study that is frankly dealing with doctor-caused cancer." Dr. Bross continued, quote, "Everyone said I was crazy to do that, and they were right. But on the other hand, if I had called my study something else and they'd turned me down anyway, then the public wouldn't know why they turned me down. I figured," he said, "it's better that the public should know that the National Cancer Institute won't support this kind of research." For 30 years, radiologists in this country have been engaged in massive malpractice, the doctor says, which is something that a doctor will not say about another doctor. End quote. So it's clear that radiation causes cancer. It does not cure cancer. It severely damages the immune system and results in lots of other horrible, painful, often permanent side effects as well. Now, I agree that not every patient develops all these side effects, but radiation continues to do its damage wherever on the body it's used, whether you're immediately aware of the damage or not. Well, how about cutting out the cancer? Can't that cure me if the surgeon gets all the cancer? Cancer is not caused by a deficiency of surgery. You don't develop cancer because you haven't had enough operations in your life. So cutting out the cancer will not cure you, because all the factors that allowed you to develop cancer in the first place are still operating in your body. If you cut out the cancer, it will just come back in the same area, or it will appear somewhere else. In order to get rid of it, you must reverse the factors that allowed it to develop in the first place. If you keep eating the foods that cause cancer and you keep living the lifestyle that causes cancer, you'll still have cancer. That's the reason that women with breast cancer in one breast have a relatively high incidence of developing cancer in the other breast. Because after they have the first breast removed, they continue eating and living the way they always did. So the factors that cause the first cancer are still continuing to operate, and then they develop cancer in the other breast. But that doesn't have to happen if you truly change your diet and lifestyle. Doctors are in such darkness that they're frequently advising women to have both breasts cut off, even when only one is affected with cancer. Some women who have a family history of breast cancer are even advised to have their breasts removed prophylactically before they even develop cancer. That's unbelievable darkness. I had breast cancer. Breast cancer is not caused from having too many breasts. Cutting them off does not solve the problem. I refused mastectomy, even of the breast that was involved with the cancer. I knew there was a way to reverse the problem. According to one textbook, Clinical Oncology for Medical Students and Physicians, and this is published jointly by the University of Rochester Medical School and the American Cancer Society, warnings are given for the dangers of surgery and even biopsy. Here's a quote. Experimental data suggests that surgical trauma decreases natural resistance to the formation of metastases. This means that the trauma of the surgery suppresses your immune system and increases the potential for spread of your cancer. Here's another quote. Needle biopsy is occasionally used, but a needle track may harbor nests of cells which may form the basis for a later spread. Incisional biopsy of certain highly malignant tumors through an open operative field may be contraindicated because of risk of spread of the tumor throughout the operative field, end quote. So, a surgical biopsy, a procedure used to diagnose cancer in its earliest stages, may actually contribute to the spread of cancer in some cases. Other researchers have found in experimental studies that major surgery has a deleterious effect on a patient's immune system and lowers their resistance to cancer. Studies at the University of Illinois subjected animals to various kinds of stress, operations, liver poisons, or chemical anesthetics. All of these, they found, decreased the animal's resistance to injected cancer cells. In this study, the chances of a tumor growing as a result of just undergoing a surgical procedure, an operation, increased anywhere from 50% to 450%. So even surgery can have a serious negative impact on your immune system. But here are the general guidelines I used. You must make your own decisions. 1, at the beginning, I wanted a diagnosis. I wanted to know if my lump was cancer, so I had an excisional biopsy. That means the main portion of the small tumor was removed. Remember, at that time it had already spread. But also remember, the main tumor at the beginning was very small, about half the size of an almond, and I had it removed under a local anesthetic like Novocaine or lidocaine, so I didn't even have the damaging effects of a general anesthetic. The operation can't always be done under a local anesthetic, but when it's possible, it's usually better for you. 2, I chose open excisional biopsy rather than needle biopsy because needle biopsy just samples tiny areas of the tumor, so it's harder to make a definitive diagnosis of cancer. Areas of the cancer may be missed in the needle biopsy. 3, if one has colon cancer that is obstructing the colon, it's reasonable to have the obstruction relieved so you can eliminate your waste material. If your tumor is pressing on a vital organ, releasing that pressure is desirable. And debulking a tumor for pain relief, as I had done, is reasonable. But you must remember that major surgery has a profound negative effect on your immune system. So consider that when you make your decision. Knowing what I know now, I would not have had even the original very small tumor removed because by following God's total health plan, I could have reversed it. But I didn't understand all 10 steps at that time. I now know also that in all the other situations I have just mentioned, trust in God can change conditions in the body that established medicine could never dream would be possible. But you must make your own decision. The next category is hormone therapy. A popular drug now is Lupron, frequently used in patients with prostate cancer. Its side effects include generalized pain, headache, hot flashes, sweats, nausea and vomiting, gastrointestinal disturbances, swelling, weight gain or loss, acne, facial hair, muscle and joint pain, depression, emotional instability, dizziness, nervousness, neuromuscular disorders, numbness and tingling of the hands, and breast changes with tenderness and pain. Estrogens, such as diethylstilbestrol, called DES, are used as palliative treatment of metastatic prostate and breast cancer. Palliative treatment means the doctor has no hope of curing you. But the side effects of these drugs are blood clots, stroke, heart attack, liver tumors, high blood pressure, fluid retention, nausea, vomiting, depression, nervousness, enlargement of the breast, migraine headache, overgrowth of the uterine lining, and breakthrough vaginal bleeding in women. Side effects in males are many of the same as I just mentioned, plus impotence, atrophy of the testicles, and gynecomastia, which is enlarged breasts in men. Then there are the anti-estrogens, such as tamoxifen. This is a drug that they're handing out like candy. Side effects are hot flashes, fluid retention, nausea, skin changes, blood clots, vaginal discharge, hair loss, allergies, constipation, mood changes, uterine cancer, and liver cancer, and studies suggest even a potential increase in breast cancer when it's used for several years. There's another group of cancer drugs called biologic response modifiers. These are drugs such as interleukins, interferons, tumor necrosis factor, and monoclonal antibodies. These are very expensive drugs used to treat cancer. The toxicity of interleukins includes significant cardiovascular complications, including seriously low blood pressure and the development of a full-blown capillary leak syndrome, which means your small blood vessels break down and bleed into your tissues. It also causes weight gain, swelling in the legs and feet, cardiac arrhythmias, heart attack, nausea, hypothyroidism, and neuropsychiatric changes that may continue to progress even after the therapy is discontinued. Interleukins has side effects which include chills and fever, rash with itching and peeling, nausea, vomiting, diarrhea, anorexia, septic shock. That means a life-threatening drop in blood pressure, tachycardia, which is rapid heart rate, cardiac arrhythmias, heart attack, hallucinations, disorientation, delusions, personality changes, and suppression on the blood formation system requiring blood transfusions. Now, I'm giving you all of these side effects because people write and ask questions like, well, my doctor says I should take tamoxifen or interleukin or interferon. What do you think? So you need to know what these drugs do, then you can make up your own mind. Next is interferon. This oncology textbook says interferon's anti-tumor effects are produced directly by poisoning of the cells. The interferons directly inhibit the growth of both tumor cells and normal cells, unquote. The general side effects include fever, fatigue, myalgia, that's painful muscles, confusion, numbness and tingling and pain in the fingers and toes, abdominal pain, constipation, nausea and vomiting, diarrhea, anorexia, and gingivitis, which is inflammation of the gums. It also causes depression, impaired concentration, amnesia, shortness of breath, inflammation of the pharynx and sinuses, and hair loss. Tumor necrosis factor can cause severe low blood pressure. The monoclonal antibodies can cause low blood pressure, shortness of breath, anaphylaxis, which is collapse, which can cause death, myalgias, these are muscle pains, and rhabdomyolysis, which is muscle destruction, which can cause life-threatening kidney failure. Where did all these drugs come from? Why is cancer treated with drugs that cause cancer? And who controls the cancer industry? Most patients think that the physicians and the researchers are in charge of the medical establishment. But these professionals are often under the control of laypersons. For example, Memorial Sloan Kettering Cancer Center in New York, one of the most influential cancer centers in the world, is controlled and managed by the Board of Trustees, who are more often than not laypersons. And frequently they are executives of corporations that have the greatest vested interest in the cancer industry, the methods and equipment used to treat cancer patients. The major players in control of the cancer industry, including the control of the information that you and your physician are allowed to know, are the following. First, Memorial Sloan Kettering Cancer Center in New York. 2, the American Cancer Society. 3, the National Cancer Institute. And 4, the FDA, the Food and Drug Administration. In the 1880s, the wealthy Astor family, who made their wealth from fur trading and tenement properties, what we would today call a slumlord, provided the initial funding for the New York Cancer Hospital, which later became Memorial Sloan Kettering Cancer Center. But along with their large contributions, they demanded control. They dictated who would occupy the leading positions on the board of directors and who would be the medical director of the hospital. In the 1920s, the Rockefellers, who controlled Standard Oil of New Jersey, signed an extensive agreement with the German pharmaceutical company IG Farben. After this partnership was established, the Standard Oil Rockefeller empire suddenly developed a great interest in the worldwide pharmaceutical business. The Rockefellers then began their systematic contributions to Memorial Hospital, and a few years later, a vice president of Standard Oil was invited to join Memorial Hospital's board of managers. He was subsequently made chairman of the newly organized research committee. When World War II came along, Cornelius Rhodes, who was involved in the beginning research on chemotherapy at Memorial Sloan Kettering Cancer Center, became chief of research for the Chemical Warfare Service of the United States military, whose official purpose was to carry out supposedly defensive studies on the effects of poison gas. But human experiments with nitrogen mustard, a poison gas, were also being carried out on cancer patients under the cover of military secrecy. Nitrogen mustard, a chemical warfare killing agent and the grandfather of chemotherapy agents, is still used on cancer patients today under the more acceptable names of Cytoxan, Alkeran, or Leukeran. It's actually here in the PDR, the physician's desk reference, the Bible of drugs for doctors. Nitrogen mustard is meant to kill people, and it frequently does that job very well when given to cancer patients. By the mid-1960s, the leading members of Memorial Sloan Kettering's board were individuals whose corporations stood to lose or gain a great deal of money depending on how cancer was treated. Individuals like Lawrence Rockefeller and Benno Schmidt of Worthington Biochemical Company, who was chairman of the board of directors of Memorial Sloan Kettering. By 1988, over a third of the entire board of directors of Memorial Sloan Kettering had ties to the medical industrial complex, whose corporations produce a wide range of known or suspected carcinogens. For example, Exxon. It's one of the world's major producers of benzene, a major cancer-causing substance. General Motors is responsible for about a third of the nation's air pollution by tonnage, according to Ralph Nader. And these are only the direct corporate links. If you look at the other boards on which Memorial Sloan Kettering directors serve, you will find asbestos manufacturers, Allied Chemical Company, manufacturer of red dyes that are known carcinogens, and other producers of life-threatening chemicals. How ironic that those who are making millions by mass-producing cancer-causing substances now also are making money on the other end, first by controlling the types of cancer treatment allowed, then by producing the chemicals used for treatment of the cancers caused, at least in part, by the very substances these corporations originally produced. With these massive corporate ties, it hardly seems surprising then that Memorial Sloan Kettering favors an expensive care approach for cancer over that of prevention. These directors bring to their jobs at Memorial Sloan Kettering the same general philosophy and interests that guide their business and financial activities: make money. The result is that research is directed away from prevention, away from inexpensive alternative natural remedies, and toward more profitable treatments. Why don't we hear this information through the media? Let's look at the media ties on the board at Memorial Sloan Kettering Cancer Center. In 1988, 2 board members were directors at the New York Times Corporation. 2 board members were executives at Reader's Digest. 1 board member was president of Warner Communications, and 1 was director of CBS. When a story about a promising alternative treatment for cancer was dropped by United Press International and Associated Press, the 2 newswire services, investigative journalists asked why. They were told that, quote, all cancer stories had to be cleared through the science editing department of the Associated Press in New York, unquote. So the story didn't run. All cancer stories had to be cleared by one group in New York City where the American Cancer Society and Memorial Sloan Kettering had virtual total control of all policies relating to cancer. All cancer stories for all the citizens of America had to be approved, just as all treatments have to be approved and by the same people. Lest you think this is an isolated example, here are a few more illustrations documenting that the media is controlled. Here's a quote from John Swinton, who was one of America's best-loved newspapermen and the former chief of staff for the New York Times. He was called by his peers the dean of his profession. In 1953, 50 years ago, he was asked to give a toast before the New York Press Club. After listening to numerous hypocritical toasts to our American free press, John Swinton spoke candidly to his journalistic colleagues. Quote, there is no such thing at this date in the world's history in America as an independent press. You know it and I know it. If I allowed my honest opinions to appear in one issue of my paper, before 24 hours my occupation would be gone. The business of the journalist is to destroy the truth, to lie outright, to pervert, to vilify, to fawn at the feet of Mammon, and to sell his country and his race for his daily bread. You know it, and I know it. And what folly is this toasting an independent press? We are tools of the rich men behind the scenes. We are the jumping jacks. They pull the strings and we dance. Our talents, our possibilities, and our lives are all the property of other men. We are intellectual prostitutes, end quote. Richard M. Cohen, senior producer of CBS Political News, said, quote, we are going to impose our agenda on the coverage by dealing with issues and subjects that we choose to deal with, unquote. Richard Salant, former president of CBS News, stated, quote, our job is to give people not what they want, but what we decide they ought to have, unquote. Few people know that there is a media monopoly in the hands of a few families and global corporations. Here are the massive holdings of AOL, Time Warner. Cancer is big business, and they're sacrificing your life in the process. How about the American Cancer Society? The revered American Cancer Society, one of the nation's largest volunteer health organizations. It collects over $400 million per year. Just get a checkup and send us a check, they say. Yet not a single breakthrough has resulted from this colossal collection of money. Obviously, the American Cancer Society benefits from the intense concern of the public about cancer. Yet cardiovascular disease is responsible for twice as many deaths as cancer. but the American Heart Association receives far less in donations and research funds than the cancer establishment. Why? Because the American Cancer Society does a splendid job of keeping the public very conscious of cancer. Hardly a day goes by without a newspaper report on cancer. The death from cancer of former Senator Hubert Humphrey, actor Yul Brynner and John Wayne, former First Lady Jacqueline Kennedy, or comedian Gilda Radner and other celebrities becomes a national drama which the public follows with fascination. The American Cancer Society was originally founded at the New York Harvard Club in 1913 by none other than John D. Rockefeller Jr. and his friends. Rockefeller even provided the funds for its founding. From the start, the Society's role was to be a shaper of public opinion. The main goal was to urge the general public to consult their physician at the very first suspicion of cancer. In the early 1940s, a group of wealthy individuals began to plan a reorganization of the American Cancer Society. Key figures among the new leaders were Elmer Boast, president of Hoffman LaRoche Drug Company, and Albert Lasker, a prominent advertising man whose greatest advertising triumph was for the American Tobacco Company. His slogan, "Reach for a lucky instead of a sweet," convinced thousands of women to start smoking in the 1930s and 40s. Again, follow the money. Lasker made money first by encouraging women to smoke. Then he made more money through the American Cancer Society by directing fundraising supposedly for research and treatment for the very cancers his advertising encouraged. Boast and Lasker introduced the most advanced Madison Avenue techniques into cancer fundraising, and dollars flooded into the society. In 1978, journalist Barry Chowka investigated the American Cancer Society and found that this nonprofit agency was hoarding and investing for profit many millions of dollars contributed by the public to fight cancer, while at the same time the American Cancer Society was claiming that vital research was not being done because of a lack of funds. Of the money the American Cancer Society spends to supposedly fight cancer, 61% goes for staff salaries, executive travel, office supplies, and other expenses. Less than 5% is allocated to assisting patients. The American Cancer Society is not interested in a cure. It would go out of business. The following incident illustrates this point. In 1952, a county chapter of the Iowa American Cancer Society ran a full-page ad in the local paper asking for the American Cancer Society parent organization to investigate claims of 4 new possible cancer cures. But the chapter was promptly expelled from the American Cancer Society. The chairman of the expelled chapter was astonished and said, "We're at a loss to know what crime we committed. We were asked to help conquer cancer. We have tried to do just that. Has the American Cancer Society another motive?" Well, the underlying motive is revealed in an article that appeared in Harper's Magazine stating, quote, "The American Cancer Society was designated by charter as an emergency organization which must disband the day a cure is found." Why would the American Cancer Society ever admit that a cancer cure exists? They would have to disband and give up that $400 million or more every year. The National Cancer Institute is a government research agency that has the primary responsibility for funding the so-called war on cancer. It hands out billions of your tax dollars in research funds in support of scientists at various institutions. Both the American Cancer Society and Memorial Sloan Kettering guide the thinking of the National Cancer Institute on many matters. In 1971, the National Cancer Act was passed, and that began the war on cancer. Before that, in the late 1960s, Congress established a national panel of consultants to study the conquest of cancer. It was this committee that ultimately recommended the war on cancer to Congress. Of the 26 panel members who proposed the war on cancer, 10 were officers of the American Cancer Society, 4 were affiliated with Memorial Sloan Kettering Cancer Center, and several others were from chemical and pharmaceutical companies, the very ones who would benefit from the millions of dollars in taxpayer money that would be handed out by the government and eventually funneled into their pockets. This is the way the National Cancer Institute works. A researcher applies for research funds. This grant request must be approved by a wide variety of scientists, bureaucrats, and businessmen. It must be the result of a consensus among these many individuals. Almost by definition, such an application must be well within the bounds of conventional science. These constraints make it almost impossible for radically new ideas to be approved by the National Cancer Institute. That's why the National Cancer Institute will never fund the investigation of natural treatments for cancer or any other disease. The recently formed branch of alternative medicine investigation at the NCI, or National Cancer Institute, has been nothing but a sham to appease Congress and especially to appease the public, who are beginning to understand that the war on cancer by conventional medical techniques is an abysmal failure and who are clamoring for non-toxic, effective alternative treatments. Furthermore, the public pays for chemotherapy drugs to be developed with their tax money, which is dispensed to researchers by the NCI. Then the public pays again, this time at monopoly prices, to purchase these same drugs from the private companies who patent them for their own gain. And they charge you exorbitant prices to buy the very drug that your tax money paid to develop. What a racket. The FDA is a government agency staffed by civil servants and political appointees. Its role is theoretically to prevent harmful or useless methods of treating cancer from entering the marketplace. Yet they strongly endorse chemotherapy and radiation, both extremely harmful treatments. In 1974, 11 FDA scientists testifying in Senate hearings charged their own agency with being a virtual pawn of the pharmaceutical industries it is supposed to control. They testified that they were harassed by agency officials whenever they recommended against approval of marketing some new drug. In 1976, the New England Journal of Medicine commented on the state of affairs at the FDA, and this is a quote: "There was open drunkenness by several employees which went on for months. There was intimidation internally by people. Division directors and their staff would engage in kinds of behavior that invited insubordination. People tittering in corners, throwing spitballs. I am describing physicians, people who would slouch down in a chair, not respond to questions, moan and groan with sweeping gestures, a kind of behavior I have not seen in any other institution as a grown man," unquote. One author, writing about these matters, suggests that this behavior seems more characteristic of an insane asylum than of a top government agency. And these are the people who brand natural healing methods as quackery. In addition, there's a revolving door between pharmaceutical companies and the FDA. Certain FDA members push hard to get a certain drug approved, and then, surprise, surprise, they suddenly quit the FDA and go to work for that very drug company. And everyone pretends that it's all legal and above board. The American Cancer Society, the National Cancer Institute, and the FDA are all in bed together. They're working for themselves, not for you. Now let's discuss cure rates. Your doctor may give you statistics on rates of cure with different types of therapies. But what does your doctor mean by cure? For years, the American Cancer Society maintained a peculiar definition of a cancer cure as a 5-year survival after diagnosis. A New York Times reporter once asked for a definition of the word cure, and an embarrassed American Cancer Society vice president admitted, quote, "I've never gone to a dictionary to look up the definition of cure. We really don't know what we mean by cure," unquote. And this was published in the New York Times in 1979. Doctors rarely use the term cure when they talk among themselves because they know that the conventional methods of treatment really don't cure cancer. In recent years, however, the American Cancer Society's definition of cure has become even hazier. For example, among the 2 million cured cancer victims in the United States, the American Cancer Society admitted that they have included individuals who, quote, still have evidence of cancer, unquote. That means that a man who is treated for cancer and survives 5 years is entered into the record book as a cure. But if his cancer later recurs and he happens to die, he'll then be in this strange situation of having been officially cured of cancer and yet dying of cancer at the same time. You will hear much from your doctor about the impressive statistics of survival after treatment of cancer. But let's look at how those figures are derived. In his book, The Cancer Industry, author Ralph Moss magnificently details the fraud and deceit associated with statistics. Here's one illustration. Dr. Hardin Jones, a professor of medical physics at UC Berkeley and an expert on statistics, aging, and the effects of drugs and radiation, states, quote, "The notion that patients treated by conventional therapies live longer than untreated patients is biased by the methods of defining the groups. If a person in the untreated category of a study, the control group, dies at any time while he or she is being studied, this is recorded as a death in the control group and is registered as a failure of the no treatment approach. If, however, patients in the treated category die during the course of the treatment, before the treatment course is completed, their cases completely disappear from the data. They are just not included in the study since, quote, these patients do not then meet the criteria established by definition of the term treated, unquote. So, a patient who dies on day 89 of a prescribed 90-day course of chemotherapy would just disappear from the list of treated patients and would not be listed as a failure. If this biased effect is stripped out, the common malignancies show a remarkably similar rate of death, whether treated or untreated, according to Dr. Jones. Also, there is no proof that early diagnosis affects survival. New techniques are able to diagnose the cancer earlier, on an average of about 6 months earlier. What does this do? It converts what used to be a 4.5-year survival rate to a 5-year survival rate, which is what they then call a cure. Nothing has changed on the survival graphs except the beginning point they choose to measure from. Naturally, the earlier the detection, the longer the survival from that point, and the more time they have to give you expensive, painful treatment. But you have not affected the real survival time at all. It's also obvious that conventional treatments have not been able to stop the rise in cancer mortality. There has been a steady increase in the cancer death rate in the United States in this century and the previous one. Cancer accounted for 1 in 27 deaths in 1900, 1 in 16 in 1920, 1 in 12 deaths in 1930, 1 in 9 in 1940, 1 in 7 in 1950, 1 in 6 in 1960 and 70, and the death rate continues to climb. It might appear that the reason for this increase is simply that we are living longer and that cancer is a disease of the old and middle age. But this is not the only reason for the increase. These figures are already age-adjusted and have already taken into account the shift in seniority among the population. In the 1980s, the standard figure for cancer cures, not really cures, but 5-year survival, was around 1/3, 33%. But suddenly, the American Cancer Society was proclaiming that 49% will be alive 5 years after diagnosis. At first glance, this seems like a remarkable improvement. How did this happen? The survival rate hadn't really increased. The cancer industry just developed a new and different standard to announce to the public. This was called a variant on the 5-year survival statistic, and they named it the relative survival rate. According to cancer officials, relative survival rate is considered a more accurate yardstick for measuring cancer progress. Relative survival rates take into account the expected mortality figures. This means that if a person hadn't died of cancer, he might have been run over by a truck, and that must be factored into the equation. With the use of this fraudulent yardstick, now they say that 49% of today's cancer patients will be alive 5 years after diagnosis. This is where the 50% cure rate comes from. That's called lying with statistics. Another serious flaw in the National Cancer Institute's number was that the NCI chose to use only the figures for white people. Statistics show that the cancer incidence rate and the death rate is higher for blacks than for whites. So the NCI chose to present the figures on whites only as the norm and ignore the death rate for blacks. But these claims of great progress were exposed as a fraud when an article appeared in the New England Journal of Medicine revealing that these figures did not include the death rate for black people nor for lung cancer patients. They just excluded those groups because their death rates were higher. More lying with statistics. There are books available documenting fraud and deceit in science in general and in medicine in particular, but you probably won't find them in your local bookstore. This book, The Betrayers of the Truth, Fraud and Deceit in the Halls of Science, shows how science really works and why scientists cheat and distort both the statistics and the outcome of the studies. And this book, Racketeering in Medicine, exposes the massive orchestrated suppression of alternative methods of treatment by the government and organized medicine. Here's another example of the cozy relationship between the FDA and the pharmaceutical companies they're supposed to control. The FDA and the Pharmaceutical Advertising Council, called PAC, which represents some 35 major drug companies, have formed an organization called the National Council Against Health Fraud. Reportedly, they are paying large sums of money to doctors and public health specialists to publicly discredit all non-traditional therapies, particularly those that are proven to have the most promise and present the greatest threat to the pharmaceutical companies. Yet the FDA regularly approves dangerous, often lethal drugs. And when one of these wonder drugs fails or causes serious injury or death in either one person or thousands of people, no one in the pharmaceutical company, the medical profession, or the FDA is raided, arrested, or jailed, as often happens to alternative practitioners. At most, the drug is just quietly removed from the market. Chemotherapy and radiation, both of which cause cancer and both of which have been responsible for hundreds of thousands, if not millions of deaths, are the only therapies that the government endorses and approves. These therapies are reportedly introduced as new approaches, promising that sometime in the unknown future, maybe we will have a cure for cancer. Yet the so-called alternative therapies are consistently accused of offering false hope. On the contrary, it's the government and organized medicine's phony and outrageously expensive 30-year war on cancer that has not only been an abysmal failure, but has exposed establishment medicine as the most diabolical purveyors of false hope our country and the world has ever known. When the phony statistics are eliminated, the long-term survival rate of cancer patients using conventional therapies remains abysmal at about 3%. This was documented as recently as 1996 in the prestigious medical journal Lancet. The cost of care for these millions of Americans with cancer is estimated to be between $4 trillion and $7 trillion over the last 20 years. That's a frightening amount of money flowing into the hands of the medical pharmaceutical cartel. Is it any wonder that they won't admit that cancer can be cured by natural methods? Dr. Benjamin Rush, a signer of the Declaration of Independence, had great foresight over 200 years ago. Here's what Dr. Rush said, quote, "Unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship. To restrict the art of healing to one class of men and deny equal privileges to others will constitute the Bastille of medical science. All such laws are un-American and despotic. They are fragments of monarchy and have no place in a republic. The Constitution of this republic should make provisions for medical freedom as well as religious freedom." End quote. What a prophet he was. Now I'm going to discuss several of the most common cancers and lead you through the process step by step of what you're going to encounter in conventional therapy. We'll start with breast cancer. The main diagnostic tests used to find a lump in the breast are mammograms, ultrasound, or a manual exam by a physician. These three diagnostic methods can tell you if you have a lump, but they can't tell you whether the lump is benign or malignant, cancerous. Let's discuss these tests individually. A mammogram is X-ray. It's radiation. Radiation causes cancer. Many doctors suggest that a woman have a mammogram every year. And for women past menopause, they sometimes suggest one every 6 months, twice a year. Well, it's estimated that the radiation from one mammogram will increase a woman's risk of breast cancer by 2%. That's 4% per year if you're having a mammogram every 6 months. After 10 years, you have increased your risk of developing breast cancer by 40%. You have dramatically increased your chance of getting the exact disease that you're trying to avoid. Ultrasound is safer and does not use radiation. It's quite accurate in mainly diagnosing fluid-filled cysts. But a manual examination by a physician has been shown to be just as accurate as a mammogram, and it has no risks whatsoever. If you already have a lump and you want a diagnosis, that has to be done by biopsy. There are two kinds of biopsy. There's a surgical biopsy where an incision is made, or a needle biopsy where a needle only is inserted into the area of the tumor and cells or tissue are withdrawn. A needle biopsy may not require a general anesthetic, but it's possible to miss the diagnosis of cancer because only portions of the tumor will be sampled. So you may get a false negative diagnosis, meaning your biopsy report will say you don't have cancer, when in fact you do in some other area of the lump that was not sampled by the needle. Open biopsy is more accurate because if the tumor is small, it can be surgically removed, either completely or in large part. And enough tissue is available for the pathologist to give a more complete and accurate diagnosis. A surgeon may want you to sign a consent for mastectomy at the same time the initial biopsy is done, but that can be hazardous because if both the biopsy and the mastectomy are done during the same surgical procedure, then the diagnosis of cancer has to be made on what's called a frozen section of the original biopsy. Let me explain what that means. Normally, if a tumor is surgically biopsied, the surgeon removes a piece of tissue which is sent to the laboratory, preserved with special chemicals, embedded in paraffin blocks or some other type of embedding material, sliced into very fine microscopic sections, placed on a small glass slide, and stained with certain dyes so the pathologist can look at the tissue under a microscope for diagnosis. This procedure takes several days, but it is a procedure that is far more accurate than a frozen section. A frozen section is prepared by freezing the biopsy tissue rapidly in the laboratory while the patient is still asleep on the operating table. Then that tissue is stained, and then the pathologist examines the tissue under the microscope. But every pathologist and every surgeon knows that the diagnosis is not as accurate with the frozen sections as with the embedded and stained regular biopsy specimens, which take several days to prepare. There are horror stories of legs being amputated in young people on the basis of a frozen section, or mastectomies being performed on women on the basis of a frozen section when later properly prepared regular embedded specimens have shown that the individual did not even have cancer. So it's generally best to have the biopsy done as a separate procedure. When you sign a consent for surgery, it is an all-inclusive consent in which you are giving the surgeon the right to do almost anything he decides is necessary surgically while you're under the anesthetic. When I had my biopsy, I specifically wrote on the consent form that I did not give consent for mastectomy, nor for lymph node removal, or for removal of any other portion of my body except for the biopsy of the lump. Then I initialed what I had written. So now, if you choose to have a biopsy and the regular sections of your excised tissue are made, and several days later the pathologist looks at the slides and makes the diagnosis of cancer, your surgeon may suggest mastectomy. And if the cancer is spread into your lymph nodes, he will probably also suggest lymph node removal. Let's first talk about mastectomy. Was your breast cancer caused by having too many breasts? Of course not. So taking them off does not solve the problem. What you need to do is reverse the factors that allowed the breast cancer to develop in the first place. And if you have cancer in your lymph nodes, that means the lymph nodes are doing their job. Think about this. If you have an infection in your foot, often the lymph nodes in your groin will swell up because they're filtering out the infection from the lymph fluid and helping to prevent the spread of the infection. Would you, in that case, go to your surgeon and say, "The lymph nodes in my groin are swollen from my foot infection, and I want you to remove the lymph nodes"? No, of course not. The lymph nodes are doing their job. They're helping you. Well, if cancer has spread to your lymph nodes are helping you in the same way. Your lymph nodes are part of your immune system. They're filtering out the cancer to keep the cancer from spreading to other parts of your body. Removing the lymph nodes will eliminate important barriers to the spread of your cancer. Then the doctor will suggest poison in the form of chemotherapy or radiation to destroy what's left of your immune system. Removing the lymph nodes, then poisoning your body with chemotherapy or radiation does so much damage to your immune system that now the cancer can spread everywhere and your body can't resist it. I refused lymph node removal, even though my lymph nodes were involved with the cancer. Once I started on the plan that made me well, slowly those enlarged lymph nodes, some as large as a walnut, reversed themselves and over time became soft and free of cancer. As I mentioned earlier, some doctors will even suggest that you have the other unaffected breast removed, particularly if you have a family history of breast cancer. But if you already have cancer in one breast, it doesn't mean you'll develop it in the other breast. The reason that there's a significant incidence of cancer developing in the other breast is that the women continue to eat and live the way they did to develop cancer in the first breast. If you reverse those factors, then you don't have to worry about getting cancer in the other breast because it's not in your genes. Breast cancer is handed down from generation to generation, all right, but not in the genes. This is the way it's handed down. Great-grandmother teaches grandmother how to eat, live, and handle stress or not handle stress. Grandmother teaches mother, and mother teaches daughter. But this chain can be broken. You don't have to eat and live the way your parents and grandparents did. You can change those habits and rebuild your immune system naturally. Most pathologists will automatically order tests for estrogen receptors on the biopsy of your breast cancer tissue. The test results will be either positive or negative. Then they will suggest certain additional drugs. I was upset when I found that the pathologist had automatically ordered those tests without my knowledge or approval because it didn't make any difference to me whether my tumor was estrogen receptor positive or negative because I had refused chemotherapy and all drugs anyway. I wasn't going to put any drugs into my body. The plan to reverse cancer is the same whether the breast cancer is estrogen receptor positive or negative. The only treatment options the doctors will give you will be surgery, chemotherapy, or radiation, which we've already discussed. You already know the generalized toxic side effects of chemotherapy and radiation. Now, here are the specific side effects if you have radiation to your breast and chest area. Radiation to the chest causes damage to the heart and can increase your chances of a heart attack and death. It can cause shortness of breath, cough, fatigue, and respiratory distress. It can also cause pericarditis, that's inflammation of the sac surrounding the heart. It can cause heart valve defects and scarring of the heart muscle, leading to decreased function of the heart, as well as changes in the esophagus and spinal cord. A significant number of patients will die from radiation pneumonitis, pneumonia, from radiation of the chest area and lungs. Late radiation fibrosis or scarring occurs in 50% to 60% of all patients. Many women are being given tamoxifen, which, as I said, causes uterine cancer, liver cancer, and there is some evidence that after several years of continuous use, it actually increases the incidence of breast cancer. How about breast implants? Irrespective of the great cover-up by the FDA, the media, and the manufacturers of the breast implants, there is enormous evidence that silicone gel breast implants have a severe negative effect on the immune system. The saline implants are less dangerous, but they are still foreign material in your body and are not helpful to your immune system. If I had breast implants, particularly the silicone gel type, I would have them removed as soon as possible, whether I had cancer or not. It is well established that the use of estrogen for birth control or hormone replacement therapy increases your risk of breast cancer. But it's a well-kept secret that abortion is an even bigger risk factor for breast cancer. I discussed this on my video, Double Blind: What Science Can't See. The National Cancer Institute doesn't want you to know that. On their website, they tell the physicians, but not the layperson. Check out the website of the National Cancer Institute. Here's what it looks like. On this side, the physician's side, they'll give the statistics on the strong relationship between abortion and cancer. On the other side, for the layperson, they don't tell you. What if you've already had chemotherapy and radiation? If by the time you see this video you have already had chemotherapy and or radiation for any type of cancer and you want to rebuild your immune system by natural methods, you can do it. But it will take longer since you have had so much more damage. If your cancer has returned and now the doctors are suggesting bone marrow transplant, you should understand that in order to perform a bone marrow transplant, the doctors must give you massive doses of chemotherapy to try to destroy all the cancer cells in your body before either giving you back some normal cells that were taken from your own body or to receive transplanted cells from someone else. But to give massive doses of chemotherapy to someone who is already so sick is criminal. You can see why the death rate is so high with this procedure. It's truly a miracle when someone survives it. If your biopsy report shows you don't have cancer, but instead you have either fibrocystic disease or a benign lump, well, any lump in the breast is abnormal. You can be happy and give a sigh of relief that you don't have cancer, but you still need to reverse the factors that allowed that lump or those cysts to develop. The breast is a water-driven organ. When the body gets dried out because of such things as not drinking enough water or drinking coffee or caffeinated beverages or too much stress, which is also very dehydrating, or the wrong diet, this encourages the formation of fibrocystic disease and breast lumps. If you change to a vegetarian diet, give up milk and dairy products and eggs, and concentrate on fruits, grains, and vegetables, give up caffeinated beverages and start drinking water and fresh homemade vegetable juice, learn to handle stress properly, and follow the other steps of health that I gave you, you will be amazed that these lumps and cysts can just disappear. There are some blood tests available that can measure certain tumor markers in some cancer patients. These tests can help you follow your progress, but remember, they will almost always go down initially with chemotherapy and radiation. But this is only temporary and gives you a false sense of security, because when the full force of the chemo or radiation takes its toll on your immune system, those markers can later skyrocket. People frequently ask me, well, how did you follow your progress? For over a year, I followed my progress downhill. My tumor was growing massively. I was getting sicker. But I wasn't going to jump off the wagon of God's health plan and go have chemotherapy or radiation. If I had done that, I would be dead now. I just hung on and kept doing everything I knew how to do. I never had any blood tests done during my recovery. I knew I was well when my tumor was completely gone by natural methods and when my health, energy, and stamina returned. And the best news is that I don't have to worry about my cancer coming back, as every other cancer patient does, because I'm no longer doing the things that cause cancer. The PSA test is commonly used to detect and follow prostate cancer. PSA stands for prostate-specific antigen, a substance produced only by the prostate cells. The PSA test may be normal in early stages of cancer, and 80% of patients with only mild elevations of the PSA, such as from 4 to 10, will show only benign hyperplasia. Benign means it's not malignant, and hyperplasia means the cells seem to be overgrowing, but they're not necessarily abnormal, at least not yet. If a man has benign prostatic hypertrophy, BPH, an enlarged prostate, there are a couple of herbs that seem to be helpful. Saw palmetto and Pygeum africanum have been shown to be effective for the prevention and treatment of an enlarged prostate. But this should be in conjunction with following the 10 steps of the health plan. If the PSA test is significantly high, the doctor will suggest a biopsy. If the biopsy shows the cells in the prostate are cancerous, the options given by the doctor will be surgical prostatectomy, removal of the prostate, which results in a very significant incidence of impotence, or radiation, including the proton therapy, which is a more focused beam and promoted as less damaging to the surrounding tissue. However, whether it's regular radiation or the proton beam, it still does not cure cancer, and it damages your immune system. All it does is kill some cancer cells. But if you're still living and eating the way you used to, you are at great risk for the cancer returning either in the prostate or in some other area in your body. And of course, the radiation causes general damage to your body, including your immune system. Radium implants are small pellets or wires of radiation that are placed in the prostate to continue delivering radiation over time. Hormone therapy with Lupron may be advocated, but we discussed the side effects of Lupron, and it's obvious that a deficiency of Lupron is not the cause of your prostate cancer. When the cancer progresses, the doctor may suggest an orchiectomy. That's removal of the testicles, a psychologically devastating procedure for any man. If the cancer has spread outside of the prostate, then frequently chemotherapy will be recommended. This, of course, is accompanied by the many side effects that we've already discussed. If I haven't mentioned your particular type of cancer, such as testicular cancer, thyroid cancer, brain cancer, stomach cancer, bone or cartilage tumors, melanoma, lymphoma, leukemia, or any other more unusual type of cancer, understand that conventional medicine will offer you only chemotherapy, radiation, and surgery, often mutilating surgery with all their devastating side effects. But the good news is the same rules we discussed, the 10 natural health laws, apply for reversing all cancer. Stop doing the things that cause cancer and start doing the things necessary to rebuild your immune system. Maybe your doctor has told you you only have a few weeks or months to live. First of all, he doesn't know. He's only guessing, and he has no right to do that to you. Let me tell you a true story. The natives of Australia are called Aborigines, somewhat like our Native Americans. The Aborigines have a ritual. If one of the male members of the tribe breaks a certain taboo, the witch doctor is called. The witch doctor arrives with his little bag of remedies. He pulls out a chicken bone and points it at the man. It's called pointing the bone. The man always dies, either immediately or within 2 or 3 days. Why does he die? Because he believes he will die. The bone has been pointed. The same thing happens in medicine. Many cancer patients die right on cue after the doctor tells them how long they have to live. The doctor has pointed the bone. The patient dies because he believes he will die. But you don't have to accept that. I know lots of cancer patients who refuse to accept their diagnosis, refuse to accept the pointing of the bone, and have lived for many years. And if they followed God's natural health plan, they've actually gotten well. Remember, at one time, I was moments from death, but I wouldn't accept it. One last thing. Disease is not physical. That's why doctors can't cure it. Disease is not mental. That's why Christian Science can't cure it. Disease, including cancer, is spiritual. It begins with heart disease, but not the kind of heart disease you usually hear about. When our heart isn't right, when our attitude isn't right, when we're filled with selfishness, impatience, jealousy, hate, anger, grudge holding, Anxiety, worry, frustration, greed, suspiciousness, gossiping, whining, complaining, being super critical of others, excessive ambition, when we're in competition with our friends for better jobs, more money, buying more cars, boats, houses, stuff, when we covet what others have, when we'll fight or get angry if our child doesn't get the chances some other child does in Little League or some other school endeavor, when the ultimate question you ask is, what do I get out of this? These are the attitudes that eventually cause physical disease in your body. Until we reverse those attitudes, we cannot be totally well. You can eat all the right food in the world, but if you're harboring anger or greed or worry and anxiety, you can't get well. It's not just what you're eating, it's what's eating you. Whether you're a Hindu, Jew, Muslim, Christian, Buddhist, an agnostic as I was for 30 years, or an atheist, or if you don't happen to give a whit about any religion, the only perfect life for us to model, the only life that will bring perfect health is the life of Jesus. Jesus came to serve, not to be served. He came to take care of others, not to benefit at their expense. Businesses are run on greed and shameless indifference to the feelings of others. Employees steal, lie, and cheat because they have no loyalty to their bosses, who in turn are using and abusing the employees. But those attitudes cause damage to the one who holds them. We think that our business methods are so progressive, that we in the 21st century are so wise, that medicine is so advanced. But more people are sick than ever before, and they're getting sicker at younger and younger ages, and medical science is incapable of turning the tide. The wisdom of man is foolishness with God. One of the most brilliant minds alive today, one of the most fabulous intellects of this century, a theoretical physicist of worldwide reputation, considered to be the greatest genius since Einstein, is confined to a wheelchair with Lou Gehrig's disease. He can't talk and he can't care for himself because he doesn't understand God's 10 simple laws of health. He has all the knowledge of the world, but he doesn't know how to be well. The wisdom of man is foolishness with God. When we learn to truly love our enemies, to do good to those who hate us, to forgive those who hurt us, to love the unlovable, that will cure our heart trouble, and we can get well. When we cultivate an attitude of love, joy, peace, patience, kindness, goodness, trustworthiness, humility, and self-control, it will change our cell structure and bring life and health to a sick and dying body. The right diet is critical for recovery, but that won't overpower an angry or selfish attitude. God is the healer. He just does it through his natural health plan. All 10 steps are necessary for recovery. The good news is you can be well. You don't have to be afraid of cancer anymore. Now you know what causes it, and now you know it can be reversed naturally without drugs. And now you also know what conventional therapy has to offer, only 3 types of treatment: chemotherapy, radiation, and mutilating surgery, none of which reverse the factors that caused your cancer, so they can't possibly cure it. And all of them cause severe suffering and often even death from the treatment. The exact 10-step plan I used to reverse my cancer is on my video, You Can't Improve on God. Your decisions are now in your hands. You have to make your own choices. But now you can make those decisions with knowledge, with wisdom, and without fear.